Is the ketogenic diet a miracle for managing diabetes, or a risky path with hidden dangers? The medical community is deeply divided. On one side, patients with type 2 diabetes report reversing their condition, losing weight, and reducing medication. Yet many doctors warn about the long-term effects of a high-fat diet, especially on cholesterol and heart health. The keto diet challenges decades of conventional advice, promising rapid blood sugar control, but raising questions about overall safety. For patients, the immediate improvements can be life-changing. For doctors, the bigger picture matters. In this video, we'll explore both sides, science, real-world stories, and practical tips, to help you navigate this controversial topic. What exactly is the ketogenic diet? It's a question that's sparking a lot of interest, especially in the realm of diabetes management. But what does it really entail? Let's break down the fundamentals of this dietary approach and understand what makes it tick. Simply put, it's a very low-carb, moderate-protein, high-fat eating plan. Think of it as a nutritional strategy that flips the conventional food pyramid on its head. Instead of relying on carbohydrates as your primary energy source, you're shifting the focus to fats. This means incorporating foods like avocados, nuts, olive oil, and fatty cuts of meat into your daily meals. Normally, your body runs on glucose, which is derived from carbohydrates. Foods like bread, pasta, rice, and sugary snacks are all broken down into glucose, which then fuels your cells. This is the body's default energy pathway in most people consuming a standard diet. But with diabetes, this system is broken. The body either doesn't produce enough insulin, or the cells become resistant to the insulin that is produced. This leads to elevated blood sugar levels and a host of related health problems. By drastically slashing carbs, often below 50 grams a day, you're essentially forcing your body to find an alternative fuel source. This level of carb restriction is key to initiating the metabolic shift that defines the ketogenic diet. Your body switches to burning fat for fuel. This metabolic adaptation is the cornerstone of the ketogenic diet. Instead of relying on glucose, your body taps into its fat reserves for energy. The liver then steps in and turns fat into ketones, which are essentially alternative fuel molecules. This process is a natural response to carbohydrate restriction and is crucial for the ketogenic diet to work. These ketones then power your brain and body in a state called ketosis. Ketosis is a metabolic state where your body is primarily using ketones for energy instead of glucose. It's the hallmark of the ketogenic diet and what sets it apart from other low-carb approaches. The typical keto breakdown, the distribution of macronutrients or macros, is very specific. About 70 to 75% of your daily calories should come from fat. This high-fat intake is essential for providing your body with the fuel it needs in the absence of carbohydrates. 20 to 25% should be from protein. Adequate protein intake is important for maintaining muscle mass and supporting various bodily functions, and just 5 to 10% from carbs. This minimal carbohydrate intake is what drives the body into ketosis and allows it to effectively burn fat for fuel. This is a radical shift from standard dietary guidelines, which typically recommend a much higher carbohydrate intake. It challenges the conventional wisdom about what constitutes a healthy and balanced diet. Importantly, nutritional ketosis is not the same as diabetic ketoacidosis or DKA. It's crucial to understand the distinction between these two conditions. DKA is a dangerous condition that primarily affects people with type 1 diabetes. It occurs when there is a severe lack of insulin, leading to dangerously high levels of ketones and blood sugar. Nutritional ketosis, on the other hand, is a controlled and safe metabolic state for most individuals, including those with type 2 diabetes when properly managed. DKA is a medical emergency requiring immediate treatment, while nutritional ketosis is a dietary approach. Understanding this difference is crucial, especially for diabetics, to avoid confusion and ensure safe implementation of the ketogenic diet. Keto isn't just about eating fewer carbs, it's a fundamental shift in how your body obtains and utilizes energy. It's about changing your body's entire energy system from being primarily glucose-dependent to becoming fat-adapted. This shift can impact hormones, inflammation, and energy levels, potentially leading to various metabolic health benefits. Grasping this mechanism is key to understanding the potential effects of keto on your body. This understanding is vital to understanding both the potential benefits and risks of keto, especially in the context of diabetes management. So, let's delve deeper and see why some doctors are on board with this dietary approach and what the potential advantages might be. Many doctors support keto for diabetes because it delivers fast, dramatic results. Cutting carbs leads to rapid drops in blood sugar and improved insulin sensitivity. This isn't just masking symptoms, it targets the root problem of insulin resistance. Studies show patients on keto often see their A1C levels fall from diabetic to normal ranges within months. Many reduce or even stop diabetes medications under medical supervision. This deprescribing empowers patients and reduces medication side effects. For these reasons, some clinicians see keto as a powerful tool, not a fad, in fighting type 2 diabetes. But not everyone is convinced. While the ketogenic diet has gained popularity, and some studies show potential benefits, many doctors remain cautious about keto. They approach it with a degree of reservation, carefully weighing the potential advantages against the possible downsides. And it's important to understand that their concerns are serious and stem from a place of wanting the best possible health outcomes for their patients. These aren't just fleeting worries. They're based on established medical knowledge and potential risks associated with drastically altering one's diet. The biggest worry, and it's a significant one, is the high-fat intake that's required to maintain ketosis. This is especially true of saturated fat, which is abundant in many keto-friendly foods. Because a diet high in saturated fat can spike LDL, often referred to as bad cholesterol, which is a key indicator of heart health. Elevated LDL cholesterol is a well-established risk factor, raising the risk of heart disease and associated cardiovascular problems. This is a primary reason for medical professionals' apprehension. Furthermore, cutting out entire food groups like fruits, including grains and starchy veggies, which are typically staples in a balanced diet, can also lead to potential nutrient and fiber deficiencies, impacting overall health and well-being. These foods provide essential vitamins, minerals, and dietary fiber that are crucial for various bodily functions. Beyond the nutritional aspects, the diet's restrictiveness makes it incredibly hard to stick with long-term, and adherence is key to seeing any sustained benefits from a dietary change. This difficulty in maintaining the diet long-term risks burnout, leading to abandonment of the diet and subsequent weight regain. It's also important to remember that keto isn't suitable for everyone. It's not a universally applicable solution. This is especially true for those with pre-existing conditions like kidney disease, pre-existing heart issues, or certain metabolic disorders that can be exacerbated by the demands of a ketogenic diet. Furthermore, pregnant women and the elderly who have unique nutritional needs face extra risks from such a restrictive plan, making careful consideration and medical guidance even more critical. Given these potential risks, medical supervision is absolutely essential to closely monitor for any potential complications and ensure the individual's safety and well-being. All of these concerns highlight why keto isn't a one-size-fits-all solution, and why a personalized approach to diet and health is always the most prudent course of action. So, with all of this in mind, let's take a closer look at what the science actually says about the ketogenic diet, separating fact from fiction. Ultimately, we need to ask ourselves, is the potential risk worth the potential reward? What does research reveal about keto for diabetes? Studies like those from Virta Health show that under medical supervision, many type 2 diabetics on keto reverse their condition, lose weight, and reduce insulin use. Randomized trials find keto outperforms traditional low glycemic diets for lowering A1C and weight. However, these same studies often report increased LDL cholesterol, a major concern for heart health. Most research covers only 1 to 2 years. We lack long-term data on safety and effectiveness. The science paints a complex picture, powerful short-term benefits, but unanswered questions about long-term risks. So what do real patients say? Let's hear their stories. Real-world stories bring keto's impact to life. Many diabetics report feeling full longer, with fewer cravings for sugar and starch. Weight loss is common, often leading to better mobility and confidence. Improved insulin sensitivity creates a positive feedback loop for blood sugar control. Some experience sharper focus, more energy, and better sleep. These quality-of-life gains can be as meaningful as lab results. Of course, success stories are more visible than struggles or failures. Still, for many, keto transforms daily life, not just blood sugar, but there are pitfalls to avoid. Keto can go wrong, fast, if done poorly. Dirty keto focuses on hitting fat and carb targets with processed meats and junk food, ignoring nutrition. This can lead to nutrient deficiencies, high cholesterol, and other health issues. The dreaded keto flu, headaches, fatigue, cramps, often strikes when hydration and electrolytes are neglected. Long-term, eating mostly saturated fats and little fiber can harm heart and gut health. A healthy keto diet emphasizes unsaturated fats, lean proteins, and plenty of low-carb vegetables for fiber and micronutrients. Ignoring food quality trades one health problem for another. To succeed, keto must be done right. But who should avoid it altogether? Keto isn't safe for everyone. People with kidney disease, a history of heart attack or stroke, or rare metabolic disorders should avoid it. Pregnant or breastfeeding women need a more balanced, nutrient-rich diet. The elderly and those with pancreatitis face extra risks from dehydration and high-fat intake. For these groups, the risks outweigh the benefits. Always consult a knowledgeable healthcare provider before starting keto for diabetes. If you're a good candidate, here's how to do it safely. Are you living with diabetes and considering the ketogenic diet? It's a big decision, and it's crucial to approach it with knowledge and caution. Here's how to start keto safely, especially if you're managing diabetes. We'll walk you through the essential steps to ensure a smooth and healthy transition. Don't cut all carbs overnight. That's a recipe for unpleasant side effects and potential blood sugar imbalances. Instead, gradually reduce your intake of sugars and refined carbohydrates first. This allows your body to adapt more comfortably. Begin to replace starchy foods like potatoes and rice with healthy fats. Incorporate sources like olive oil, creamy avocados, and nutrient-rich nuts and fatty fish into your daily meals. Avoid dirty keto, which relies heavily on processed foods and artificial ingredients. Instead, focus on food quality, prioritizing whole, unprocessed foods, not just hitting your macro targets. Fill a significant portion of your plate with low-carb, non-starchy vegetables. These are essential for providing fiber, vital vitamins, and minerals. Eat the rainbow, even on keto, meaning choose a variety of colorful vegetables. Dietary variety matters for optimal health and a balanced intake of micronutrients. Stay adequately hydrated by drinking plenty of water throughout the day, and replenish electrolytes, especially sodium, potassium, and magnesium, which can be depleted on a keto diet. Consider taking supplements if needed to address any potential nutrient deficiencies, but always check with your doctor or a registered dietitian before starting any new supplement regimen. Closely monitor your blood sugar levels regularly, and work with your healthcare provider to adjust your diabetes medications as needed under their medical supervision. A well-formulated ketogenic diet should be plant-rich, emphasizing non-starchy vegetables and healthy fats. It's not just about meat and cheese. A balanced approach is key for long-term sustainability and health. When done right, and with careful planning, the keto diet can be a powerful tool for managing diabetes and improving overall health. But it's definitely not a one-size-fits-all solution and may not be appropriate for everyone. Always prioritize your safety and well-being above all else. Work closely and communicate openly with your healthcare team to ensure the keto diet is a safe and effective choice for you.